Dear colleagues, greetings to Riga. Hello and thank you for having Ukraine on the agenda. This is the fourth year of war since Russian full-scale invasion in 2022. Ukraine's health system continues to operate, but under extraordinary pressure. WHO has verified more than 2,700 attacks on healthcare, including 224 people who were killed and 881 injured. It is important to notice that the destruction and suffering in 2025 is higher than previous years, in spite of the dialogue and expectation for the day after. The impact on Ukrainian people and the health system has been immense. Colleagues, when we look closer to the situation, the war has increased health needs, especially mental health, rehabilitation, trauma care, and non-communicable diseases. Millions of people face continuous attacks and cannot access health care because of the war. And also financial barriers. Ukrainians are under enormous physical and psychological strain now and for the generations to come. But we have also demographic shift and aging. Furthermore, over 6 million who are now living outside of Ukraine and over 3 million internally displaced. The movement of population continues as we experience daily shelling, drones and missile attacks impacting civilian population and infrastructure. Now, let me reflect more on non-communicable diseases as we discuss today. Speaking of non-communicable diseases, we focus on risk factors, access to services, and, very important, surveillance. WHO supports the government with NCD surveillance during the wartime, including analyzing and collecting alcohol consumption data. We conducted 2 nationwide surveys in 2023 and 2024. These surveys show key trends in alcohol use and behaviors among Ukrainians aged 18 and above. What we have learned is that Ukraine today, we have to deal with a huge burden of NCDs responsible for more than 90% of deaths before the war. During the wartime, this burden is getting even heavier. Colleagues, we gather today in Riga to discuss in particular alcohol control. Alcohol use often becomes an additional risk factor that may aggravate health conditions and undermine stress coping strategies. As alcohol has been wrongly considered as stress relief, it is expected that the burden of alcohol consumption will be increasing. So, what have we revealed? Overall, alcohol consumption increased. Current drinkers rose from over 50% in 2023 to 57%, which is 7% increase. Heavy episodic drinking also grew by 5 percentage points, from 49.2% to 54.2%, indicating a worrying normalization of risky drinking habits amid ongoing war and instability. Looking at the gender and age patterns, men drinking 5 times more than women and report higher heavy drinking rates, reaching to 69.4% versus approximately 40% among women. Young adults aged 18 to 29 have the highest heavy episodic drinking rate at 67%, highlighting a key target for prevention now. Regarding health and social effects, we see a rise in perceived harm from family members drinking. from 70.5% to 85.3%. It is 15 percentage points. Even though only 3 to 4% reported household contacts with heavy drinkers. However, only 3% of drinkers received medical advice to reduce their consumption, indicating a gap in health system engagement and to support them. This last figure shows that people with risky alcohol use have very limited access to timely health advice and health care. Now, let me look some positive notes. The public attitudes show high awareness of alcohol risks, especially related to mental and injury-related harms. Yet, support for stricter alcohol laws under martial law remains high at more than 67%. And available healthcare requires quality improvement and modernized standards of care. To summarize these findings, 3 points. First, drinking behaviors are polarized. While most Ukrainians drink moderately or not at all, there is a minority who engages in harmful drinking. Second, gender differences persist and youth at risk is climbing, especially among economically stressed groups. And third, enhanced roles for health professionals in early detection and briefing interventions are essentials now to prevent excessive alcohol use. Now, turning to our actions in Ukraine to address these issues, challenges at the time of war. WHO collaborates with the Ministry of Health and the Ukrainian Public Health Center on several strategic policy documents. One of them is the Alcohol Control Action Plan, which has been placed for public discussions recently as we meet now. Our team ensured it includes WHO NCD best buys as interventions. We also provided expertise to the draft national guidelines and clinical standards to treat alcohol use disorders, which will be published in November 2025. In partnerships with the government, we cooperated on the elaboration of the model for providing assistance to people with the substance and alcohol use disorders. These key policy documents will create a framework for consistent and coordinated efforts to tackle the increasing burden of alcohol use. However, implementing them will require significant efforts and also resources. Additionally, we are taking the following steps. WHO trains healthcare professionals to use brief interventions through programs on NCD management frameworks, including the online courses, which are very popular in Ukraine. Our team facilitated the integration of these interventions into the postgraduate curriculum of medical universities, including the nurses. Together with the Ukrainian Public Health Center, we conduct awareness campaign in communities and disseminate guides for public advocates. WHO assessed alcohol taxation policies and is promoting best buys for alcohol control. The country office of WHO also supported Ukraine's participation in the technical and networking meetings within the EVID Action project. And this is WHO action. We have many other partners who are addressing the challenge. Dear colleagues, we believe that with coordinated efforts and continued support, we can reduce the growing burden of alcohol-related harm in Ukraine. Thank you for your attention and commitment to support Ukraine's health system during these challenging times. You keep Ukraine in agenda, you meet and discuss, but also we welcome all of you to Ukraine more often. Thank you and have a nice conference.